Next up is some disorders here of the eyeball itself. Right. And I do ask some, again, I don't know if I'm going to ask corneal abrasion. Abrasion just is a scrape, okay? You've all had an abrasion on your knee if you fell down and scraped your knee. So we've all had an abrasion. So again, just being able to, understand what a word means. If somebody asked if you had a scratch on the surface of your eyeball, well, you're going to say, I have a corneal abrasion. If you're going to ask, you have an inflammation in the outer lining of the eyeball, well, that's conjunctivitis. Itis is inflammation of, and conjunctiva is that outermost lining of the eyeball and the inner part of the eyelid. Scleritis, again, itis is inflammation of, just like it was earlier with conjunctivitis. And sclera is the other part of that. That's the root word. Okay, so this is a inflammation of the sclera. Not very common. Same with rheumatoid arthritis. So again, just breaking the word down. I'm not asking you, I'm not going to give you a whole bunch of diagnostic gobbledygook. Okay, but if I'm asking you which one of these involves an inflammation of an eyeball structure, and scleritis is there it is. Itis is inflammation of, and sclera refers to the sclera, the outer part of the eyeball. Here's glaucoma. Glaucoma is when we get a huge buildup of fluid within the eye. And with glaucoma, this is kind of the field of vision you will see. Okay, this is kind of the field of vision that you will see. Glauc means glauc, G-L-A-U-C. Again, oma always means kind of tumor, or in this case, a mass. It's a mass of fluid. Okay, it's a mass of fluid. Glauc, G-L-A-C, just refers to opacity. It's opaque. It just causes a fantastic, awful, kind of blurry image. The blurry image for this is really on the periphery. Okay, you lose vision due to that increased ocular pressure. It kind of pushes the lens away from where it's supposed to be. And so it creates a very weird, blurry image, or it causes you to not have a lot of peripheral vision. And that's what you're seeing right here. Okay, this is what you're seeing right here. Okay, because that lens is not able to move properly. Along those lines is cataracts. And cataracts is when we have a buildup of crap on the surface of our cornea. Very opaque. Okay, very opaque. And this truly creates a very, very, very blurry image. Okay, think of this except seeing the entire field of vision. Okay, so you get to see all the background with these two little boys, but it's extremely blurry. Okay, extremely blurry. Not fun for these individuals. Okay, not fun. I'm not going to ask anything about this stuff, so you can cross this out. So I apologize. I thought I removed all the slides that I wanted you not to worry about from this presentation. So this is one of them. Here's macular degeneration. The macula, remember that macula lutea at the back of the retina there? If we lose some of those photoreceptors back there, obviously we won't be able to create an image in that field of view. So here we have some loss of those photoreceptors in a specific spot of the retina there, and that's referred to the macula. Again, this is your area of greatest visual acuity. So you have some photoreceptors that are dead, broken down, and it causes you to lose field of vision. Blurry, obviously, but a loss of an entire field, that's not really good. The last thing here is in terms of, well, there's a couple more, I guess. One of the things that's very common that we usually talk about is retinal detachment. The weird thing about the retina, if I go back to the picture here of the retina, go here. there is nothing that is really helping to anchor this down. It's not being held in by tight junctions. It's not being held in by anything. Okay. It is held in position. There it is. You can see it close up. It is held in position by the pressure of the fluid back here in this posterior cavity. If for some reason you lose some of that fluid in the back of your eyeball, it will cause that retina to pull away from the choroid. It detaches. And they call it shadow vision. It's how would I describe that? It's like somebody's pulling a curtain down over your eyeball. Okay. You have some field of vision that's still bringing in information, but the top part obviously is going to start falling in, and that's what gives you that curtain effect where it's just pulling down the shade in your eyeball. And obviously the retina is not in a position to properly focus an image, so you don't really get an image being focused at all in that area. Surgery is going to be needed to reattach their retina in this case. Again, just not a good situation. Blows to the head may cause this type of condition. Diabetic retinopathy, again, apathy is going to be a condition of, right? This is a condition referring to the retina, and it's caused by diabetes. The blood vessels that are there in the eyeball are very tiny, very, very, very delicate, okay? And that causes hemorrhaging of those blood vessels, and that can affect your field of vision. So you get this kind of, looks like someone's taken tiny little pinholes and just perforating the back of the retina because it's causing some issues with those photoreceptors. Retinoblastoma, night blindness. Night blindness is caused by vitamin A. Okay, that is something of importance, so I will leave that in there. Night blindness is a first detectable sign of a vitamin A deficiency. Okay, coming to nutrition, we talk about it there a little bit. Retinoblastoma, again, this is just a condition pertaining to the formation of a tumor there within the eyeball, there within the retina. RET, retina, OMA, tumor or mass, pathy, sorry, I'm not doing retinopathy here. Blastoma, blast is just an immature cell. So again, this is just a tumor of an immature cell within the eyeball. As cells reproduce, becomes out of control growth. Then we go from immature to mature cells, and with retinoblastoma, there we have some kind of cancer-causing cell of a retinal cell that's become cancerous. Again, obviously not a good situation. The last thing here when it comes to conditions here, again, just what do words mean? Pathy means disease. Blast means immature. Retina. Scopy means to view. So again, what do these word elements mean? Okay. Pathy is generally seen as a suffix. Scopy generally seen as a suffix. Retin generally seen as a root word. Okay. Blast generally seen as a root word. Okay. What do these elements mean? If I've said it again. Know what all these parts and pieces mean.